Hi, this is Dr. Brian Castelein with Brighton Foot and Ankle, and today I'm here with Brock. Brock's one of my favorite guys. We've been through quite a few OR cases together, some big cases, some small cases, but Brock always has some good stuff to bring into the operating room. So I wanted to ask a little bit, tell me a little bit about yourself. You've been with a couple companies, we've done some things.
I've been around with a few companies now, so I've been in the industry 10 or 11 years, in the OR over 10 years now, so I got started with Dr. Castelein right pretty quick after you were out of residency.
Yeah, so that dates us a little bit, so let's not play that game.
Yeah, I'm not gonna mention that one. But been around the block a few times, so always love coming to the OR and working with Dr. Castelein on cases that he's got going on.
And what's your focus in your current role?
My current role, I am doing foot and ankle sales, so we do both a variety of soft tissue fixation and metal plates and screws, biologics, etc., but strictly focused on the foot and ankle and trauma space.
Perfect. So tell me, what's some of your favorite products for the foot and ankle?
So, I mean, could really get into the weeds here. We have so many different products, but I guess a couple of my favorites would be the new biologics that we have around. So, you know, there is a new trend coming with joint preservation and trying to fix the joints before they deteriorate so that you don't have to fix them, which would then lead into my next favorite products, which is probably just any sort of metal cases, complicated hindfoot, midfoot cases. So anything from MTP fusion to subtalar joints to ankle fusions, some of the bigger flat foot cases that we've done where you can utilize some of these different metal plates and screws to fixate bone. So you come in with a deformed bone or a fracture. We have a number of different ways and different types of plates to fixate them and get patients back on their feet.
Perfect. And so what else are some other industry trends? So like, where do you see foot and ankle going? Because you're not just in my cases, you're in a lot of different surgeon cases throughout our area. So what are some of the things that you're seeing both from a physician perspective as well as for a developmental perspective from your current company?
So yeah, I do operate kind of all over the state, or I'm in surgeries all over the state. One thing that I'm seeing a major emphasis on is biologics. So it's called, we call them orthobiologics. Basically using the patient's own biology to help stimulate growth and prevent cartilage damage and joint preservation and so forth. I think that's kind of the next frontier in orthopedics. We've kind of come a long way from what we were doing 20, 30, 40 years ago as far as hardware and putting metal into patients. And the next big step is going to be, all right, well, how do we preserve these joints? So there's all sorts of different kinds of biologic products, such as, you know, own autologous blood products.
Which that's like a PRP and things like that we can even use in the office, in the operating room. What are some of the other things that you're kind of talking about?
So there are also some it's called autografts. So you'd be using bone products from donors outside of the field to help spur along healing.
And that can be done both for bone or soft tissue stuff.
Bone or soft tissue. So
right,
you can have anything from amnion products to your own blood products with growth factors, but a lot of emphasis around growth factors and amniotic products to kind of spur along healing both in soft tissue and bone.
Yeah. And correct me if I'm wrong, some of the things that we like to say is kind of a plate is a plate, a screw is a screw that we use to fixate the bone, but it's the biologics, it's the soft tissue stuff that really can transform and protect the bone underneath and make the difference in your surgery.
Yep. I will say one other thing that I've especially been doing with you that is coming more and more in our industry. They've been doing it over in Europe for years and years and years, but minimally invasive surgery is really starting to catch on and being indicated for a lot more surgery here in the US. So for us, we've done minimally invasive bunions where you're just getting poke holes in your feet. So instead of having these big open incisions that take a long time to heal, leave nasty scars, we're going to more of a much smaller approach using just burrs and percutaneous screws. So you're preventing scarring and basically having improved healing. We're starting to see that a lot more.
So yeah, we've had some fun with that and looking forward to some more good cases.
We'll continue.
So thanks for hanging out with us, Brock.
Thanks, I
appreciate
appreciate
it.